This video is going to demonstrate how you can use the web version of SORMAS to do the data entry because of the challenges we are currently facing with the app. So you open your browser, either Google Chrome, Explorer, whatever type that you have. Then you enter this web address. Make sure you enter every word as they appear. https://surveillance.gh.org/SORMAS-UI. So once you enter, you press load or you press the enter on your keyboard. Then this interface will show. It will request for your username and then the password. So if you don't have your username and password, kindly reach out, and then together with the IT team, we can assist you to have your login credential. After you enter them, you click the login and wait for the system to load. Now, when the system loads, it will normally bring you to dashboard. We'll look at dashboard another time, but today we are going to look at how to create a new case. So when it brings you to the dashboard, you come and press on the menu items, cases. Then you move your cursor to the right upper corner here, where you locate your new case button. You click on it. Then case origin is always set to in country. Your transmission classification should be unknown. Date of report is when the patient reported, so we assume today. You create your EPID number by entering the appropriate coding. So GHA, this is Greater Accra, GHA, Okankwe North, then 2026. Assuming this is our first case, then we enter 001. You may leave it blank also for the system to generate, but because we have backlog of entries for last year from around week 50 to 52 and also week 1 up to week 2 of this year, to be better to create the PIN numbers manually. Otherwise, if you enter for instance, your case number 16 is the first you are going to enter, and then you don't manually enter the PIN number, the system will assign 01 to it when indeed it is your 16th case for this year. The truth of the matter is that all the entries you have been making using the app from the beginning of the year and last 2 weeks of last year haven't synchronized if you use the app version. So if you are clearing the backlog, you either start from where the system last synchronized, and I'm going to share those lists with you, the names of the backlog. Then you manually enter the PIN number, or you start from the last entry and then let the system continue with the numbering for you. So for the disease, you click the drop down and look for influenza. You may search, then it will pop up for you. When you enter INF, which is the first 3 letters, the system will bring it for you. Then you select. These are pre-filled based on the user credential. We are using Achimota account for this demonstration. The place of stay, as I always say, you leave it at facility because the patient came to the hospital. So you enter the first name. For the demonstration, we would use my name for demonstration purposes. The date of birth, assuming we don't know, we'll leave it blank. On the next page, we will have the access to choose the age. The sex is male. National health insurance ID. If available, you enter passport number and all of that. You state the present condition of the patient, either alive, dead, or buried. Then the date of symptom onset, which let's say in the last 3 days. The phone number of the patient should be entered, very important. Then their email address, if they do have. Now, when you get here, you go over the records you've provided to be sure they are accurate before you click save. The difference between the save button on the web, what we are demonstrating, and the app which you previously used is that for this, the moment you click save, the system automatically communicates with the server, so you don't have to synchronize. Once I click save, it is saved on the system. So you have to be very certain that the information is accurate, because once you click save, you may not have the access to edit some of the records. So now that we are very certain everything is okay, I'll click save and wait for the system to communicate. Now it says case saved. So for the web, I will need to manually navigate from case, go to case person, which is like the demographics of the person. I'll manually have to move the cursor to hospitalization. I'll manually have to move to symptoms, manually have to move to epidemiological data, choose contacts, case samples. But you know the app, the one we use on the tablet, the one that is installed, once you click save, it automatically moves you to case person. So for the web, you need to select and then update those records. So we are currently at the case directory. So we'll click on case person, which is more or less like the demographic of the patient. So because we didn't know the date of birth, now we can enter the age manually, which is 35. Then we choose the years. If it was a newborn, we can choose day, or neonate, we can choose day. If the person is less than 1 year, you can choose months and write the age appropriate. But this patient is adult. So the sex, we can go over it. If we made mistake, we can edit the CADA. If the person is a health worker, you can state the CADA and what have you. We have chance to enter passport number, health insurance again. This internal token is not relevant for now. The occupation, we need to choose the occupation of the patient. Very, very necessary. So if the person a farmer, butcher, hunter, what have you, flu is occupational risk, disease. So it's very important to show us the occupation of the patient every time. So our patient, looking through this option, is not here. He's a health worker. So we go through and come and choose healthcare worker. Educational level, the person has tertiary. Then the position of the person, he is a disease control officer. So you can choose it as such. The address, very, very important. So where does the patient stay? So you choose the region. He's in Greater Accra. The district is Ablekuma West, in around Dansoman. So the street is Commodore Street. Some of you have been leaving this blank. It's not good. You have to show us the address of the patient, their house number. So it is Commodore Street, house number 17, block 17B. Then the city is Dansoman. If they have their GPS coordinates available, you enter the latitude and then the longitude and then the accuracy, which normally should be below 5 meters. So it's very important. If the GPS coordinates are not available, at least tell us the locality, which is the city, the street, and then the house number of the patient. Please, the occupation, education, and the address are very, very important. Some of you have not been filling it, and it's not the best. So after we've done this, we go over the records to be sure everything is okay. Then we click save. So we can update the address as requested. So like I told you, for the app, the system would have automatically moved us to hospitalization, but the web, you need to manually do that. So we are done with the demographics. We now come to hospitalization. So this important question, which distinguishes ILI from SARI? We know if you are ILI, you will not be admitted. If you are SARI, you are admitted. So was patient admitted at health facility as inpatient? This patient is OPD, so we'll choose no. Once you choose no, all the other questions here are not applicable, so we can choose no. If the patient was admitted, then now we need to fill date of admission, whether they were mild, moderate, reason for hospitalization, whether they stayed in ICU and what have you. Once they didn't go on admission, all the other questions are no, so we can save. And this applies to only ILI. If it's SARI, you fail. Now we manually navigate to symptoms, then come and record the person's body temperature. Please, this is very important. Whether the person reported fever in their history or they did not, this question is asking you what is the current body temperature of the patient when they came to the hospital. So you record the body temperature based on the thermometer reading. So let's say the patient was around 37.6. The source of the body temperature you choose, maybe we use infrared non-contact thermometer. Then now we come and choose the clinical signs and symptoms. To navigate quick, because the symptoms are a lot and most are likely to be no, you come to clear all and come and choose set clear to no. This will choose no as response for all the symptoms and signs. Then you navigate through the ones that the patient presented as yes. So though the current body temperature is below fever, but in the history taken, the patient told the clinician that they had fever and probably took some paracetamol. So there's history of fever. So you change this to yes. They had runny nose. They probably had sore throat, and then they were having difficulty in breathing. So you go through the ones that the patient complained as yes, and then you change them from no to yes. Then if you are able to establish which symptom came first, you can choose from the list of the yes. Maybe the patient said they first had fever, and then that was the first symptom that came. So after that, you go through the records, making sure everything is okay. Then you click save. Then we come to epidemiological data, which looks at exposure details. So the questions here are not really crafted to the way it is on the case-based form. So for most of the cases may not be applicable. So we would go through it and see exposure details, the type of exposure that they had. You click on new entry and fill if they were exposed to any wildlife, animal, or what have you. If not applicable, you can just leave it at no and then you would save. Then we come to contact of this patient. If this patient reported having contact with other people and we are doing contact tracing, then we'll fill this button. But for case creation, we will not fill for now. So we'll come straight to case sample, then come and navigate on the new sample. Mostly on the tablet, this button will be hidden. So you need to move the screen to the right corner to be able to see it. So you click on new sample. Then the day the sample was collected, likely to be the first day they came. The sample type is nasopharyngeal and oropharyngeal. So you choose this for the two. The reason for testing is presence of symptoms because this patient is symptomatic. For some cases, they may be reason because they were exposed to an outbreak, screening, and what have you. But for routine purposes, they are mostly because of presence of symptom. The sample source, this is from a human being. Then the fill sample ID, which is the barcode. So because you are using the web, you don't have the chance to scan because you don't have an external barcode scanner to the tablet. So you enter it manually. So you look on the barcode, then you look for the code 25-79781. So you type it as it appears on the barcode scanner. Reason for sample for rate testing, no. So you choose the laboratory, which is Noguchi. Then you request your lab test, which is PCR. Then your send details. the day the sample was dispatched, likely to be the same day. Then after that, you save. So now you are done. When we reach here, now we've created all the case from the demographic to the sample detail. If we want to check if our case has actually been created, we just have to click on case lists. Then we show less filter, and then we can see that our first case is showing here, which is Obed Ofori Bangdomi. So that is how you create a case using the web version. I hope this helps.